Welcome to GovCast. I'm your host, Melissa Harris, and GovCIO Media and Research is live here at the 2022 HIMSS conference in Orlando. Throughout the conference this week, we're here to connect with health IT leaders from federal agencies and top subject matter experts, and we're here to share those insights with you. We'll dive deeper into the work that various leaders are helming across the health IT space, and we'll be sharing those conversations across GovCast, HealthCast, and CyberCast, so make sure you follow across our shows so you don't miss out. In this episode today, we'll break down the Department of Veterans Affairs AI Tech Sprints. This program, ran by the VA's National Artificial Intelligence Institute, looks to prototype different AI models intended to improve the veterans' experience in short, you guessed it, sprints, and eventually aim to scale those solutions to address various veteran care needs. The sprint aims to help sharpen the way the VA addresses everything from mental health to privacy concerns. Here to break the sprints down with us is Rafael Fricks, VA NAII computer engineer. We'll talk about the structure of the sprints and exciting goals he has ahead for the program coming up soon. Thank you, Rafael, for joining us at HIMSS. This is an exciting conference, and I know it's very busy, so I'm glad you're here to join us.
Thank you for inviting me.
Of course. So we're here today to talk about VA's tech sprints. So can you just start by giving our listeners an idea of how the model for the tech sprints accelerate the development of novel AI tools for improving veterans' healthcare?
Sure, just a quick introduction first. I'm Dr. Rafael Fricks with the National Artificial Intelligence Institute. I'm a computer engineer, and I lead the AI Tech Sprints, which are a collaborative opportunity for us to invite teams from, it's a mixture of companies, universities, and non-governmental organizations to work on a prototype with the VA for a period of about 3 months. And how that accelerates, a translation of these new devices into healthcare is that, traditionally a company might base their development of their product off government data, but it's a long cycle where they'll have to wait till, something is made available. They'll develop the product, usually have to go through several iterations, and then once it's a completed project, traditionally, that's when the VA would get involved and maybe make a purchase. The AI Tech Sprint allows us to work directly with companies in the prototyping phase. We provide some subject matter expertise. We have access to clinicians. We're the largest health system in the United States. So we can also provide some limited snippets of data in some contexts as well. And the idea is that through a 3-month process, we can help develop a prototype or enhance an existing product and really tailor it for needs at the VA so that it can be deployed more readily. And, after the tech sprint, of course, we go into more advanced testing and have to go through regulatory processes to get it into clinics, but it's a start.
Yeah, I just have a quick follow-up to that, and I'm wondering, what does the award process look like throughout, choosing who you partner with and when you decide to take a certain solution and scale it up?
Sure, yeah, we usually have a very traditional process for recruiting companies, or I should say, actually, we have our information sessions. We announce this opportunity through challenge.gov, which is a government website for this kind of opportunity. We also have our AI VA community newsletter, which is open to the public, and I highly recommend people sign up for that. That's usually where we announce this kind of opportunity. But so when we open a new tech sprint, we'll have an announcement, and there'll usually be some sort of submission process. Now, I'm talking about usuals because we're looking to reiterate on what we've done in the past for this next upcoming tech sprint. But we open up a application process, I should say. Teams fill out a short form to be considered. We invite a select number of those teams to participate, and then it's relatively straightforward at that point. We have weekly interactions with these teams and guide development, and leads up to certain milestones where we check for the effectiveness of the prototype.
Excellent. And while you have your own process for developing AI with these partners, there are different federal directives coming down from above, like the EO on maintaining American leadership in AI. So how are these overall federal standards or directives impacting the way that you develop AI through these tech sprints?
Sure. First, I should say that, a lot of people in our office have had influence on those executive orders, that we provide a lot of the subject matter expertise for artificial intelligence across the federal government. We work to build sort of the combined strategy, and in fact, we published the VA AI strategy. I think the best resource for that would be, for interested listeners, is the AI.gov page that has the National AI Initiative. But one of the key components of many of these different directives and strategies that we have is the principle of trustworthy AI, that we want to ensure that applications of AI that are adopted by federal agencies adhere to our trustworthy principles, which are spelled out in like the VA AI strategy. And those broadly relate to, the effectiveness, the transparency, the equitable and ethical deployment of AI, so that AI solutions that are adopted by government should adhere to those principles, or be retrofitted to adhere to those principles, or decommissioned if it's not something that's feasible. But the idea is that we have strong, effective solutions that are reliable and that consistently provide value to whatever service it may be.
Definitely. And it's really nice to see that aspect about how your agency and other agencies are helping inform these federal directives, because I feel like oftentimes we don't really look at that collaborative aspect. It always seems like it's coming from above. So thank you for that. So diving into the VA tech sprints, what are some of the projects that have come out of them, and how have you seen them bolstering veterans healthcare?
Well, we've had a number, but principally we're part of the research service, so they're not directly in healthcare right now, but we're going through the process of testing a lot of these solutions in more prospective studies to really, before we get to the point where it's something that's made available in the clinic directly. But some good examples, though, actually, and this is one that is, I think, at this point already being deployed, is that in the initial tech sprint, the first one that happened in 2019, one of the products that we looked at was for medication adherence. So this is an app that the veteran or the patient would install on their own device. That app could securely access then their medical records, with their permission, of course, as well as drug databases that the FDA makes available. And so with this app, they would put their medication in the palm of their hand, point the camera at the medication, and it would detect what medications were in their hand, identify them, and that was a way of ensuring that you could log that they were taking the right medication and consistently. Other examples that we're pursuing, for instance, there's an orthopedic prototype where we're combining a lot of data from wearable sensors to make recommendations for physical therapy. That's in a very early stage right now. And finally, we have a lot of suicide prevention initiatives. Unfortunately, that's an issue that the VA is working very hard to address. It's unfortunate that it's such a prominent issue among veterans. But we have a couple initiatives, for instance, applying natural language processing to improve triage of messages received by the VA so that we can direct our attention to those that are most vulnerable. And another initiative where we're looking to have patients opt into a system that would monitor their smart device usage to see patterns of behavior that might be troubling.
Excellent. Thank you for sharing some of those. And obviously, you're still running this program. There are many sprints ahead. So looking ahead, what are some of your upcoming plans for your sprints, and what do you hope to accomplish perhaps just in this year?
Well, so a big role of our office's involvement has been in contributing to the new direction we're taking towards privacy-preserving technologies, that we want to be able to securely access data. We want to make data available to the right researchers and product development, but we have, first and foremost, a duty to protect the private health information of our veterans. So that was a limitation in some ways for the tech sprint model that we had previously, that if you wanted to work with multiple companies, of course we can't release PHI to those companies. So for the next tech sprint, what we're looking at is instead a method of receiving outside solutions, so like any team that's competing in the tech sprint would then give us a solution that we could run up in a secure cloud environment within the VHA firewall. And once we verify that it's a secure solution, that it's something that's not going to leak information or cause us any kind of problems within our system, of course this would be in a sandbox type system, we could then provide some data to that secure environment and test the solution on actual veteran data, on actual de-identified veteran information, and evaluate the solution independently, because that was a limitation of the previous structures, that we had to run by some sort of external validations and then bring them into the VA through pilot programs to actually test how effective the solution would be for veteran data. With this new approach, we would have a few sort of additional requirements before starting the tech sprint, but that would allow us to get much further along in the piloting process.
Yeah, and I'm wondering if this focus on privacy is coming through with the recent boom in zero trust. It's coming up from above again with the White House and its EO last year. So does that impact in the sort of newfound focus on zero trust and cybersecurity impact your decision to go for this?
We're also involved in informing those kinds of policy decisions, that there is certainly an approach to zero trust that also allows us to partner in very mindful ways. And so our office, myself included, are working with the White House in a fast-track action committee to have a report on privacy-preserving technologies and secure ways of sharing data towards the end of the year. So this will be a report that we send up to inform policies such as the zero trust approach that we're taking now. But the intention is that, there is certainly we're trying to ensure that our information's protected, that there are secure ways to work on these projects. But on the other hand, we do need to make some of this data available. And some of the stories we've heard, for instance, from cancer patients who may be terminal, is that they would like nothing more than to have their data contribute to part of that solution. At that point, it's no longer a privacy concern, but this is an individual determination, and we certainly don't take that determination away. We just want to find technologies that allow us to preserve privacy while being able to act on some of these projects.
Yeah, we talk about privacy in all sorts of contexts across the government, but in healthcare, it's just a different monster, because some people, like you said, with cancer, really want their data to, help people down the road or even themselves, So that's a great point. And as I'm going to probably be asking everyone else across the conference, what are one or two key takeaways that you want to give away to your audience as they come to hear you speak here?
My presentation, now we have a few here from the National AI Institute, but my presentation will be focused on the AI tech sprint process, what worked in the past, what worked in the previous one that we just concluded about a year ago, and what direction we're looking to take it in. And, this is a model that we hope to replicate across different agencies, and we certainly had a lot of communication about that, but we had a lot of, I would say, very productive outcomes of the last tech sprint, but at the same time there are limitations that were sort of found in retrospect that we'd like to address with by pitching a new iteration of this process.
Excellent. And we definitely covered a lot of what you've done and what you look to do forward here too. So it'll be nice to hear further with your session, or others to hear from your session, more in depth what you're doing there. And also, there are lots of talks happening here at HIMSS. So what kind of central themes do you think will be really critical, or will be the big highlight of the conference, and what kinds of sessions or topics are you zoning in on here?
Well, so this is my first visit to HIMSS, and so I'm sort of just looking around for myself for the first time now here, but we're certainly looking for tools that incorporate AI, especially for clinical decision support. And so, one of the big waves that I think will be the future of how these technologies are applied are in secondary uses, where secondary use is the reuse of existing data for, additional value. A good case would be like, say, you go into your doctor's office for imaging, like there's a specific concern of some sort of cancer. Well, once we have that image sitting on our server, is there a way that we can use AI to look over that image to see if there's any additional findings that might be, credible and worthy to look into? And so, when you define credible and worthy, you got to really look into the trade-off of is it something, we have to evaluate the model's effectiveness at consistently finding value. That sometimes, you don't want to biopsy everything, but you also don't want to lower the threshold so much that nothing ever gets biopsied.
Yeah, that's a great point, and I think is one that, we hear different iterations of, like Ryan was saying, the testing process, and here you are trying to find some greater value in whatever you're trying to prototype. So I think that these are definitely themes that will be cross-cutting across HIMSS this week. And thank you for joining us on the podcast. It was lovely talking to you, and I hope you have a great first round around HIMSS.
Thank you. It's a pleasure to be here.
Thanks for tuning in. Follow our other shows for more coverage throughout the conference this week, and head to GovCIOmedia.com to keep up with our HIMSS coverage. We'll be covering some of the key sessions throughout the conference, and we'll release daily newsletters so you don't miss a thing.
GovCast, along with Cybercast and HealthCast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to GovCIOmedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them in your favorite podcast platform, and if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@gcio.com.